Some people develop psychiatric, psychological, and neurological complications after a concussion. I'm Dr. Andrea Furlan, a specialist in physical medicine and rehabilitation in Toronto, Canada. This video is the fourth of a four-part series about concussions. In the first video, I explain what concussion is, its symptoms, and how it is diagnosed. In the second video, I explain when the person can start resuming exercises and physical activity. The third video is about how to treat headaches after concussion. Today, let's talk about mental health complications after a concussion. A concussion is a type of traumatic brain injury, usually after a bump, a blow, or a jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. The type of complications may include problems concentrating, attention deficit, hyperactivity, obsessive and compulsive thoughts, post-traumatic stress disorder, anxiety, depression, paranoia, impulsivity, and sleep problems. It is really important to get a complete and comprehensive evaluation of their medical history, psychological and psychiatric history, also their social history and nature of the injury. Each person is a unique individual, and all of these details need to be considered when making a diagnosis of a mental health condition. It is also very common that the patients who develop mental health complications after a concussion also will say that they are experiencing pain. The first line of treatment for people with a psychiatric, psychological, or neurological complication after concussion is counseling. This can be delivered by a doctor, a psychologist, a trained psychotherapist, or counselor, or even a peer. Counseling will help the person to understand their symptoms, how to cope with them. Even people who are severely affected, they can get help in counseling because they need help to reduce stress, improve sleep, and talk about their problems. When selecting your counselor, try to find someone who has a good personal connection with you. Sometimes they may have personal experiences with concussions, or they have the technical knowledge, and they can be adaptable to your needs. And they are current with the scientific studies and have a good communication style. In some cases, the person might need more than one counselor, perhaps for marital counseling, for professional athletes, for workplace accommodations, for return to school or return to work. In terms of psychotherapy, the professional may choose different types of interventions. They can vary from cognitive behavior therapy to a more existential therapy. If the person has a diagnosis of PTSD, then trauma therapy might need to be started. If the person is diagnosed with severe depression, then they might need to add an antidepressive medication to the counseling. Antidepressants are non-addictive and they may also help with sleep. If the person has severe anxiety, they may need anti-anxiety medications like Benzodiazepines. These medications have the potential for dependence and addiction, and therefore it's better if the person does not use them daily, but only when needed. If they have attention deficit and hyperactivity disorders, they may need stimulants. And if they have impulsivity, mood problems, and anxiety, they may need mood stabilizers. There are a lot of things that we know from science that improves brain health and brain function. Because our thoughts and emotions are products of our brain, it makes sense to focus on the things that protect the brain health. It is really important to avoid refined sugars. It is incredibly important to prevent diabetes. How can a person prevent diabetes? Well, they need to keep their weight under control, losing weight if they are overweight. But if they already have diabetes, they need to control their blood sugars really tight. We know that the higher the blood sugar levels, the worse it is for the brain function. Another thing that causes damage to the brain health is high blood pressure. The person needs to stay away from too much salt and eat a heart-healthy diet. We also know that too much stress is not good for the blood pressure. So practicing relaxation, journaling, mindfulness, meditation, gentle movements, these are things that help to reduce the blood pressure. Do not smoke cigarettes. It is bad for the brain and all tissues of your body. I have another video that I talk about nicotine. If you want to have good brain health, make sure you move. Exercise is medicine. Actually, exercise is better than medicine because it prevents so many diseases, not only one. I don't know of any pill that has so many benefits than exercise. Just get moving. At least 150 minutes of moderate intensity exercise per week. You can do this like 30 minutes, 5 days, or 50 minutes, 3 days. If you don't have time to do all 50 minutes in one time, break into small exercise snacks. What you eat is extremely important. An anti-inflammatory diet is what I usually recommend to improve brain health, avoid chronic pain, and prevent a number of other diseases. If you stick to a Mediterranean diet, you will be avoiding pro-inflammatory nutrients. The key ingredients are fish high in omega-3 fatty acids, legumes, nuts, fruits, vegetables, green leaves, and reduce the amount of red meat, processed food, and added sugars. Stay away from alcohol. This is a toxic substance to the brain, and even though it is readily available, it's not good for people with concussion. Also, stay away from marijuana and other substances that alter the mental state. Get adequate sleep. If you want to give a good chance for your brain to function healthy and happy, focus on your sleep. Watch my other video about 10 tips to achieve a high efficiency sleep pattern. Do not forget to keep stimulating your brain, always learning something new. This will stimulate the brain to regenerate and grow. And lastly, we know that social isolation is a very dangerous lifestyle. The brain needs stimulation, healthy contact with other people. We are meant to be social animals, not to live alone or without other people. So to summarize, the most important aspect in helping a person who developed mental health complications after a concussion is to treat the person as a unique individual. Each person is different and they have different stories and symptoms. There is no cookie cutter recipe, like one recipe that works for everybody. The symptoms may last months, they can fluctuate in intensity, and it's really important to seek medical and psychological care if anything changes. I made this video in collaboration with Concussion Legacy Foundation, a charity organization based in the US with chapters in Australia, Canada, and the UK. If you want to check their resources, visit the website concussionfoundation.org. And remember, this video is not medical advice. If you think you have a concussion, please talk to a healthcare professional. If there is any emergency, go to the nearest emergency department or call an ambulance. This video is only for educational purposes. Share this video with anyone that might need this information. Thank you for watching. Goodbye.